So Jeremiah is our fourth child. He is our third boy, and he is a sweetheart.
So I feel like he's very emotionally intelligent to where he can always kind of tell how people are feeling and the right thing to say or the right thing to do.
Jeremiah is a young man who has energy to fill the room. He is full of ideas. He's a businessman and a student and a brother and a son and just a wonderful young child.
Well, when I found out I was pregnant, it was a surprise because it wasn't something that we were trying to do. But of course, we were pregnant. I told my husband. He was happy. We were all excited.
We were going to have another child. We didn't know if it was going to be a boy or a girl at the time, but it was just a good place in our life. We were at the right age. We were making babies. Like, things were good.
4 months pregnant, and one of my blood tests came back a little wonky. So they wanted me to come in and see a specialist. They were doing all of the things there, and then the room got kind of quiet.
I noticed her pressing in different areas and kind of concentrating on different areas on my wife's stomach. And, well, I'm going to go get the doctor. There was something that she saw, but she couldn't really talk about it. So we were just in a place where it just kind of went silent.
They showed us that his heart had not formed right and that there should be 4 chambers, and they didn't see all the chambers, and they didn't see blood flow going where it should, but that he was still very small, and as he grew, they would be able to see more and see how severe it was. And they gave us the word that they thought that he might have, which was hypoplastic left heart syndrome.
I just saw it as one side of the heart was strong and the other side was just kind of being knocked around, wasn't working the way that it was supposed to.
His eyes, I think his eyes are what stand out the most, where his eyes they're just sweet eyes. And they were just looking at me, and all I could tell him was, I'm so sorry, I'm so sorry, I'm so sorry.
He was born with a heart problem that is uniformly fatal without some sort of surgical palliation or procedure.
So Jeremiah was born with a congenital heart lesion that is called double outlet right ventricle. He had a small mitral valve and a small left ventricle, which really meant that he was unlikely to be able to have a heart that could be septated and supply blood both to the lungs and to the body.
But I got to hold him for about 30 seconds, and then they had to take him. And I didn't know if I would get to see him again. I didn't know if I'd get to hold him later. He was on the ventilator. He wasn't awake or anything like that, and I could only touch his hands. And I just told him, Mommy's here, we're gonna see you tomorrow. And we went home. At one point during the night, they told us we could call, so during the night we were calling and just checking in. And at one point during the night I called, and they said, we were just about to call you because his heart had stopped. They were able to stabilize him. So right away, it was 5 or 6 in the morning, and we got in the car and we came down. It just wasn't the same baby I had handed them. And I just didn't know what to think after that. I thought that he was just getting worse and worse and worse and worse. And at this time, it's the morning, the doctors are doing rounds, and he flatlined.
I remember just hearing the beep, just a long beep.
He had become tachycardic. His heart was just beating way too fast, and it just stopped. So after 6 weeks in the hospital, they were saying we'd get to go home. They said we were at the hospital a lot. We had to go back a lot. Once we were in the hospital in January again, then his cardiologist started seeing signs of heart failure. And it was at that point that they said, there's nothing that we can do to make it better. He's gonna need transplant. And without transplant, then he's not gonna make it.
When we're thinking about transplant, it's something you want to push as far down the road as you can.
So we were up all that night and listening to what Arvila said, what the doctors were saying, and, you know, it just seemed like all night, but by the time it was over, you know, he was fine.
We had to wait and wait, and then we finally found a donor that was willing, her parents were willing to give the heart to me because her brain was too big. If her parents said no, I probably wouldn't be here right now.
We just think that Jeremiah was able to find such a kind, caring family to think enough to give life back to him, life that was lost to them, to give it back.
Once it was over, he came out and he said, "It's really good. He's doing really well." I mean, I couldn't ask for better as far as his heart goes. His heart he's been doing great.
It gives me a lot of joy to hear that his quality of life is terrific, and he wants to do normal things, and he can do normal things.
I want to be a football player in the NFL. I want to be a part of the Chiefs.
What did you want to be before that?
I don't know. A doctor?
Yeah, that's what you told me before.
I could be a doctor and a football player.
Before a transplant, sports would not have been an option. After transplant, his heart is just like anybody else's heart, so it's strong. And Children's, from the beginning, has always respected maybe how I feel. I felt like I was listened to. The people, the nurses, everybody there, they cared about the children. They cared about you.
My doctor's name is Dr. Ballig. I think she wants to take care of me and wants to make sure I'm healthy.
Without fail, when his name comes up, the whole room is smiling. We know that there's going to be a funny story, or he's going to have something new to share with us. And this is true of so many of our patients. It's a wonderful feeling to know that they trust us and they support what we're doing. Our ultimate hope is that we won't need to transplant human organ in the future, and that we'll have technology, or we will have figured out how to transplant a heart that can last 40, 50 years rather than 10 or 20 years, which is what we see in pediatrics right now.
You need to have money to do research. You need facilities, you need people. And having organizations drive the research and the progress forward by providing the fundamental materials and financing and things to move something from a good idea to a research project, to a product, to a clinical process is essential.
I am just thankful for American Heart Association, because without organizations like this, we wouldn't be able to make any medical advances.
My son would not have the heart that he has without medical advancement being what it was. Here he is now 10 years old, and we're always hoping for another day, for another year, for another healthy biopsy and all the many procedures that he still has to do, that they would come and they would go, just pass with time, and that he would be able to live life. In Jeremiah 29:11, it says, "I know the plans I have for you, says the Lord, plans to prosper you and not to harm you, but to give you hope in a future." That is one of the things that we hope, is that Jeremiah can continue to have a future.